Hello everybody, welcome to day 112 bajillionth of lockdown. Well, never thought we would have to do this, but oh well. Today we're going to have a little Ray Mears lesson in dentistry. It took me 5 years, but you'll be fine. You guys will be great. So we are, as you might be aware, most of the dentists are on lockdown. In fact, all the dentists are in lockdown. We've got 5 hubs set out in Northern Ireland. You can't access those hubs unless you do it through a dentist. And those are really dealing with emergency and urgent care. And I mean urgent care and severe emergencies. So there are some fairly basic things that you can do at home. The first thing I'll always say to you is phone. Phone your dentist. If you're concerned about anything, phone, because your dentist knows you and they can give you the best information for you that they can. They've got your records, they should have access to your records, and you're fine. Now, if you don't have a dentist, and we've had a few calls from people who just don't have a dentist, and what we're advising is that if you don't have a registered dentist, that you go to the last dentist that you remember seeing. And that way, somebody has got records, dental records of you somewhere, and they've got x-rays, and no x-rays is better than none. So go to the last person that you remember going to, and they should be able to give you some help. But let's say we'll just go for some fairly basic things. We're going to give you some information here on what to do and what definitely not to do. What not to do is almost as important. So for some little things that we've been having lots of calls about. So one of the most common is that you get a filling. Filling comes out, that you're in lockdown and things get too much for you, and you decide for some reason to put your chocolate bar in the fridge, or there's a bit of your kid's Easter egg and you've decided you'll have a bit of that or a bit of chewy sweet, and you break a tooth or you knock a filling out. So first of all, any swelling at all, you need to be very careful on what you're doing. So if you've got any swelling at all, phone your dentist. Don't be trying to stick anything in. Phone your dentist first of all. But if your dentist is kind of has spoken to you and everything's okay, then you can try and fill it. Now, we in the practice we've got this stuff, which is dental filler. We've got one that you don't have to mix, and you just keep your tooth nice and dry and stick it into the hole, okay, and squidge that down, and that should fill the hole for you. It's getting more and more difficult to get this stuff, this dental temporary cement. So getting quite difficult now to get this stuff. There's a few pharmacies still will have this, but I know that I spoke to some pharmacists yesterday and they were having trouble accessing it even for themselves. So I had to do a little rescue mission there. Other things that we can do, all we need is something that we can seal that hole with. So we're going to try this stuff, baby cheeses, like they used to say in the nativities of the little kids. So we're going to go for a baby cheese, and we can use the wax off that. You just peel this back, and the wax is quite handy. It's very good for things as well, like orthodontic wires. Some good videos on the British Orthodontic Society, and you'll find some YouTube videos there on some problems with if your kids have got orthodontic wires that are giving problems, or brackets giving problems. But this stuff's great because it's quite easy to roll up. It's nice and safe. It won't do any harm. Okay, so what you can do is you peel that off, roll it into a ball, and then that's you, and you've got something that you can use there to fill up any gaps. And it's quite soft, quite easy, but all you're trying to do here is keep the coal out and seal that up. So, nice easy one there for you. Next thing, we're trying to think about things that are easy to get. So, crowns coming out. Now, you can use some of that temporary dental cement for crowns. However, some of it's quite thick, it's quite difficult to use. And for crowns with posts on, it really can be very difficult to use and doesn't stay in terribly well. So crowns that come out can be a choking hazard, so be aware of that. But we all know the saying, it may not be urgent, it may not be an emergency to for one of the hubs, but for you, if you've got to make a Zoom call with your boss, or if your kids are coming along to deliver the groceries and you're left with maybe like a front crown that's come out, you want to maybe try and get something just to tide over the gap. And what we would suggest is you could use some of this stuff, which is temporary denture, we could use, denture fixative and denture adhesive, and it's quite good. You can put it on. Now this will not be a permanent fix. It will just last you the length of your Zoom call, or it will probably last you the length of your kids coming to drop off the groceries to you. That's fine. So you just put that out. This gloops up, and it's quite good because it won't do any damage. It gloops up over time, and it'll not do any damage to your tooth or to your crown. What we would say is please, if you've any mercy, don't use super glues or nail glues or anything else. Those are not designed for use in the mouth at all. Some of them give out poisonous gases, you can burn yourself with some of those things, so please be really, really careful. The other thing is that if you're trying to use them on things like posts, you'll find that quite often people do attempt to do it, but part of it's glued up already, and then whenever you put your crown in, you actually damage the tooth underneath, which will cause permanent damage to your tooth, which cannot be fixed. So please be very, very cautious about what you're doing with your home dentistry. Check with your dentist first. Your dentist is here. I know we're here 7 days a week, giving out advice to everybody, that we've got the wonders of modern technology now. We've got video calls, and we can do video triage, so lots of stuff that we can do. So please speak to your dentist first of all before you attempt anything to them. And in the meantime, keep your mouth really, really healthy and clean. So make sure you're brushing. It's kind of hard to remember what day of the week it is, so just be careful that you're getting up, you're doing your normal routine, you're cleaning in between your teeth, brushing your teeth really well, and at night time as well, and that will keep loads of gum problems at bay too. But listen, everybody stay safe out there, and we'll be back as soon as we possibly can. But in the meantime, our telephone number is 028 91 46 2234. Thanks, guys.